Should you take an osteoporosis medication drug holiday? Deciding whether to take a break from osteoporosis medication can seem complicated, but understanding the facts can help. A drug holiday is a planned pause in treatment, often considered for certain patients after several years of medication use. Specifically, with bisphosphonates, which are common osteoporosis drugs, a drug holiday might be considered after 3 to 5 years if your bone density is stable and you haven't had fractures. The main goal is to reduce the risk of rare but serious side effects linked to long-term use, such as atypical femur fractures and osteonecrosis of the jaw. It's important to remember that bisphosphonates stay in your bones for a long time because of their long half-life. This means their protective effects can continue even during a drug holiday. This is different from other medications like denosumab or anabolic agents such as teriparatide, abaloparatide, or romosozumab, which tend to lose their effects quickly once stopped. For these drugs, stopping treatment usually requires switching to another therapy rather than taking a break. The decision to pause treatment depends on your individual fracture risk. If you are at low or moderate risk, your doctor might recommend a 2 to 3 year drug holiday after 3 to 5 years of bisphosphonate therapy. This can help lower the chance of side effects while still maintaining bone health. However, if you are at high risk for fractures, your healthcare provider may advise continuing treatment or switching to a different medication without taking a holiday. Taking a drug holiday can have benefits, like reducing medication burden and lowering the risk of rare adverse effects. But it also carries risks, such as a potential decline in bone density and increased fracture risk if the holiday is too long or if lifestyle habits that promote bone health are not maintained. To help protect your bones, it is essential to keep up with good habits like eating enough calcium and vitamin D, engaging in weight-bearing exercise, avoiding smoking, and limiting alcohol intake. Since osteoporosis is a chronic condition, drug holidays are not meant to be permanent. They are carefully timed pauses based on your personal risk factors and ongoing monitoring. It is crucial never to stop your medication without consulting your healthcare provider. They will evaluate your bone density, fracture history, and overall health to decide if a holiday is appropriate and when to restart treatment if needed. In summary, a drug holiday from bisphosphonates can be suitable for some patients after several years of treatment, but it must be personalized. Regular checkups and bone health assessments are essential to ensure that your bones stay strong and your fracture risk remains low. Always discuss any changes in your medication plan with your healthcare professional to make sure your treatment aligns with your specific needs and health status.